Hi friends, I am Dr. Himani Sharma. Today I am planning to discuss a very interesting topic regarding the myths during pregnancy. So let's face it, once you become pregnant, you will be getting a plethora of advice from your well-wishers, your elderlies, your neighbors, your relatives, and also through YouTube, then Google, that do's and don'ts in pregnancy. So your mind is confused regarding what is true and what is like a misinformation. So today let's discuss and be clear in our minds like what should be followed during pregnancy. So starting from myth number one, eat for two during pregnancy. So this is wrong. Obviously during pregnancy your diet should be healthy and good, but the total increase in calorie which is required during 9 months is only 300 to 400 calories above your daily average diet. So this increase in calories can be met by adding few healthy diet or snacks in your meals, which can be like a bowl of fruit or oats, sprouts, or some dairy products like a glass of milk or curd. So if you add healthy diet, definitely you will gain good calories. So you should know that on an average the weight gain during 9 months should be around 10 to 12 kgs. But your total weight gain is individualized. It depends upon your pre-pregnancy weight. So those females who are already overweight during conceiving, on an average they should gain only around 6 to 8 kgs. Those who are underweight, they can gain around 12 to 14 kgs. So if you are overeating or eating for two, on the contrary, it will just make you obese, it will make your muscles too tight, increase the fat content, and the chances of an unhealthy pregnancy increases. Myth number two is eat lot of ghee during your 9th month of normal delivery. So this is a very funny misconception and misinformation which we hear in our practice. So many patients ask, like elderlies in the family are telling that you are not getting labor pain. So in 9th month, eat lot of ghee on daily basis, either in milk or in add in your diet on an extra basis, and it will help in normal delivery. So it is totally wrong. So actually if you are adding ghee, a lot of ghee in your diet, then it will just cause loose motion, stomach cramps, and there is no benefit. It won't let the baby down in the pelvis and increase the chances of normal delivery. On the contrary, if you are having a lot of high calories during the entire month, that will lead to lot of weight gain, obesity, and the flexibility of your pelvic floor muscles decreases, which further will decrease the chances of a healthy and normal delivery. Myth number three is an interesting one. So you can guess if it's a boy or a baby girl by looking at the belly or the heart rate. So during baby shower, many of the patients tell us that they have, the relatives have performed, a test where the wedding ring is placed on the top of your tummy and in which direction it goes, or the shape of the belly tells the sex of the baby, whether it's a girl or the boy. So all this is just misinformation. See, the sex of the baby is already determined in first trimester, and the shape of the belly has nothing to do with this. It depends upon your husband and your genetic or chromosomal makeup, and it won't change the sex of the baby. So this is something to really laugh about. So coming to myth number four, you should look at pretty things as it will make your baby beautiful. So again, we have been asked by many of the patients that elderlies in the family are telling that you should hang beautiful pictures of pretty babies and you should not look at ugly things. It determines the beauty of your baby. So definitely there is no link between what you are looking at and which will determine the beauty of your baby. So we know that the beauty or the looks of your baby will be determined on the basis of the genetic composition of you and your husband. So looking at pretty things won't make your baby look pretty or ugly. Myth number 5, eat lot of coconut or kesar daily to have a fair baby. So it's again a funny linkage. So all the eating habits, they don't determine the complexion or the fairness in your baby. So the patients do ask that can we have coconut water on daily basis, or while whether eating kesar in my milk will help in increasing the complexion of the baby. So there is no link between your diet and between the color of your baby. Definitely, if coconut water or coconut is good because it is very rich in electrolytes, and if you like the taste of kesar, you can add it in your diet. But as such, there is no connection between your eating habits and the color of the baby because it is predetermined based upon your genetic composition. So myth number 6 is morning sickness happens only in the morning. So actually morning sickness itself is a misnomer, because most of the time what we see in our practice that this nausea sensation happens all the more during end of the day or during evening. Nausea sensation happens in pregnancy mainly in the first trimester and continues till the beginning of the second trimester. But as the baby starts to gain weight after 5 months, your appetite improves and then your nausea sensation also decreases. This morning sickness or morning nausea happens all the more because you are empty stomach throughout the night. So the simple solution or the simple way to alleviate this is that if you have your meals at frequent intervals, then this will decrease the bad taste in your mouth, the acid secretion which happens during night. So what we advise our patients that you can have some ready to eat items like raisins or almonds soaked in water, which you can have early in the morning and then do brushing. It will decrease morning sickness to a very good. So myth number 7, you should not have hot shower or you should not dye your hair during pregnancy. So again, see, having a warm water bath is actually helpful during pregnancy because it decreases your muscle aches, back aches, and it makes you feel well. But what is not advisable to have very hot spas or baths, because already the body temperature during pregnancy, your core temperature is little on higher side. If you have very hot spas, that will cause dehydration and you'll feel unwell. Regarding putting color in your hair or coloring your hair, this is a very common doubt, but definitely the dose or the amount of chemicals which is used in coloring hair is very small in amount and it is not at all toxic that it will harm your pregnancy. So definitely you can color your hair during pregnancy. You have all the right to feel happy, to feel glowing during pregnancy. Myth number 8, no exercise in pregnancy as you will have premature labor. This is absolutely wrong. What we advise to our pregnant mothers is that light to moderate amount of exercise at least during 5 days in a week is mandatory during all the trimesters of pregnancy. You should consult your gynecologist if your pregnancy is high risk, or if you have certain conditions like low lying placenta, cervical stitch or twins or any high risk pregnancy where bed rest is recommended. Definitely your gynecologist will guide you against the exercise. But otherwise, in a low risk pregnancy or a normal pregnancy, certain amount of exercise is always recommended. Exercise helps you to increase the blood circulation to the baby. It helps in metabolizing your food. It decreases all the ailments of fullness of abdomen, bloating, then acidity. It helps to increase the flexibility of your pelvic floor muscles and increases the chances of a normal healthy pregnancy. Because on the contrary, if you are not exercising or not doing any physical activity, you will just keep on gaining weight, your muscles will become too tight, and obesity itself is a risk factor which will make your pregnancy unhealthy. So again, coming to myth number 9, which is an interesting communication, is that my heartburn means my baby has lots of hair. So friends, heartburn during pregnancy is a very common symptom, especially in first trimester when the hormonal changes are at its peak And again in third trimester, when your whole tummy is full with the uterus and the baby, and your intestines have very less space, so the digestion becomes delayed, there is a lot of bloating and fullness, and you experience a lot of acidity, heartburns. So if a female is having a lot of heartburns, it doesn't mean that your baby will be born with lots of hair. Again, the hair and the color, the complexion or the looks, it depends, everything is predetermined upon the genetic makeup of you and your husband. Heartburn only means that your digestion is affected and you should do a lot of physical activities or contact your doctor regarding this problem. So finally coming to the last myth, myth number 10, and it is a very important myth, that don't get vaccinated while you are pregnant. So I am talking about all the vaccines during pregnancy. So during pregnancy there are mainly three vaccines. One is a plain tetanus shot, then second is a flu vaccine, and third is the Tdap vaccine, which is a triple vaccine effective against tetanus, diphtheria and pertussis or whooping cough. So these are the diseases by which you or your newborn child can get affected. So the advantage of vaccinating the mother is that the antibodies or the protection passes through the placenta from the mother to the baby. So mother is also protected during whole 9 months, and after the delivery your baby will also be protected for the initial months of his or her life. Apart from these three routine vaccines recommended by WHO, now as Government of India has already given consent for COVID vaccination during pregnancy. So this is the time, friends, when you can get the COVID vaccine in any of your trimesters, and please come forward to get vaccinated, because the side effects of vaccination are really less in comparison to getting COVID during pregnancy, which we are seeing to be very fatal in this third wave of COVID virus. To know more about the COVID vaccination, please consult me or try to contact with me. So these were the common myths. I really hope that you might find this video helpful and informative. If you have any further queries or any other confusions regarding the simple things during pregnancy, then you can come forward and ask personally from me. Be safe. I want you to cherish these 9 months of pregnancy, because this is a beautiful phase of your life, and don't get scared because of these myths or misconceptions, and be safe and be healthy. Thank you.